Dupuytren's contracture, treatment by percutaneous needle release, using an alternative technique. Dupuytren is a condition in which the normal fascial plane just below the skin of the palm changes, thickens, forms nodules and cords, and with time causes flexion contracture of the hand, most typically the ring and little finger. Percutaneous needle release, or rapid neurotomy, is performed by many hand surgeons around the United States and around the world. Most techniques demonstrate an inline orientation of the needle along the long axis of the cord and along the long axis of the hand. An expressed concern is injury to the tendons and nerves which lie deep to the cord. Supposedly, the needle is introduced into the cord, careful not to enter the tendon, and then the edge of the needle bevel is used like a knife to cut the cord. However, if the needle is rotated 90 degrees transverse to the hand and held flat to the palm, then the only structure on the far side of the cord is skin. The needle can be introduced just below the cord by feel, and the edge of the needle can be used orientated superiorly, lifted upward away from any important structures, and cut the cord like a knife in a very safe manner. So I think this is a marginally safer technique for percutaneous Dupuytren's release. Here's some examples. On the left-hand side, you see this gentleman with 3 cords, and the right-hand side, the deficit of extension of the long ring and little fingers. A week later, you can see his hand. He has full extension. There's only 2 stitches. The rest are little puncture wounds where we use the needle. On the right-hand picture, you see the full extension, essentially healed skin. The sutures are removed. He had full extension, full flexion, no deficit of function, and no therapy was required. Here's another example. This is a nice, discrete cord to the ring finger. The metacarpal phalangeal joint extension deficit was about 30 degrees. This picture demonstrates the needle being introduced transverse to the cord, flat to the palm, being introduced by feel, and then the bevel is lifted, cutting the cord from underneath toward the skin. And in this manner, the nerves and tendons are kept safe. The only structure that can be harmed is skin on the far side, and that's a little consequence. Here is that same patient in the post-op dressing, a Band-Aid. That's all we had to use. She had good extension, good flexion, no sutures, and a Band-Aid. Here's the same patient a month later. On the left, we see full extension of the fingers. On the right, you can see there's no sutures, the skin is healed. And again, no therapy was required. Try this technique. It's easy, it's safe, has quick recovery, and I, for one, have been pleased with my results in appropriate cases.